everyone, I've never really made a YouTube video for this page, so this is new for me, but a lot of people have requested to see how I organize my medical supplies, so I'm gonna do that. Sorry it's kind of messy over here, but Home Health comes every week and they do my PICC line dressing, and then they also get vitals and blood work and get everything up to date for my doctors, and then I text my doctors and we change anything we need to change. Everything is sorted in my Home Health folder. So let's get to how I organize things. This is the first shelf. So I have all my flushes and heparin over there, and I have so many because I get TPN, fluids, medication through IV. So I need a lot every single day. Those yellow ones are some of your more intense heparin, and then the blue ones are what you usually see. Those are empty syringes. Those syringes are my small ones and my very large ones. These are like the normal size. These are Q-tips. I usually use them for collecting scents for my service dog, and then I keep them in a jar. Moving on to the other side over here, we have kind of like go stuff. So the medical blanket and the medical drawer, I have like dirty laundry hamper thing and some socks. Sometimes they don't always give me this bracelet, and I kind of need them to know that I have an allergy and I'm a fall risk, because there have been some incidences in the past. This is for hazardous materials like needles. We have stuff for PICC line dressing, so the clavs, and then extensions, the bags. I usually use those bags for not just biohazard, but also for my arm to go over it when I shower, because sometimes I don't always have that one from Amazon that kind of goes over it, so to protect from water getting into your PICC line. These right here are all my batteries for my CAD machine, because I have like an infusion pump that constantly puts the fluids and stuff in my body. Here's all my tape. Here's the antiseptic, skin cleanser, and I have tons of gloves. These are actually more flushes. I have flushes for days, and I also have boxes in the other room of flushes. So over here we have fluids and hydration. We have LR, lactated ringers. We have normal saline. These are for gravity. This is the tubing for the CAD infusion pump. This is for the TPN one. This is for the hydration. And this is if my blood sugar is really low, I'll hang one of these because it has dextrose in it, so it will bring my blood sugar up. Most of those are LR. And then my normal saline's kind of right here. I will do banana bags, if you know what those are. It's where I kind of inject the vitamins, and this bag turns yellow, and I'll inject it into right there. And it will give me vitamins, especially when I can't eat or I'm just really dehydrated and I'm feeling really icky or sick, because I have autoimmune issues. So that's kind of what I need. So that's the whole cabinet here. This is my pantry. We have another cabinet we're still finishing building. This is my IV pole. This is a drawer full of needles, the needles for the syringes, and then all the things if I was to do a normal IV and actually stick myself. This is all my Zofran. These boxes are the connectors to the tubing. These ones right here. This is extra Zofran. They give me enough to take quite a few a day, but I don't take all of them, which is why I have so many extra. These go over your PICC line. I'm starting to build another drawer of alcohol pads because you just never use as many as they give you. The green caps for your PICC line. These are like kind of napkins. I use them for Halston, my 2-year-old, to wipe her hands off most of the time. Over here we have exam gloves. We have gauze and non-adhesive pads. These are actually trash bags that they give me, but I put them over the bags that have the vitamins in it because the sun could hit the vitamins and take the vitamins out of your bag, essentially. And the easiest way you can put that. And these are the stickers so that I know when to change my tubing. Gauze. This drawer has all of my Tegaderm and PICC line dressing change stuff, and stat locks, the anchors for your PICC line. I have plenty of stuff for ports as well, but I currently don't have a port. My doctors and I have been talking about getting a tunneled catheter eventually, so we'll see if that happens. I really would rather not have anything. This is Lovenox so that I don't get blood clots, so I give myself a shot every single day at the same exact time. Alcohol prep pads, there's boxes upon boxes of these. These are CHG wipes and the granny panties they give you for when you have a baby, but sometimes they're very helpful when you have a very heavy flow. This is glasses stuff, which I don't really use because I have terrible vision. Doesn't really help. I have peripheral blindness, so this is pain reliever over here. I have eye drops and your basic stuff for dry eyes. The biggest thing that helps me is having the red sunglasses that are specifically made for epilepsy so that I don't have seizures, and I'm less likely to have seizures with flashing lights. But these are all my pain reliever stuff, and I try not to use them because it's easy to get used to them. This is all the stomach stuff. We have barf bags, all of the breathing, respiratory, nebulizer stuff, asthma stuff, anaphylaxis stuff. This is all my regular medication for if I'm actually sick. This is actually in here because it has a little hole in it and there's a syringe that can go into it. So if I need to give the baby medication, I can through this. This is the thermometer that I don't actually have to put to their head because they absolutely hate even the ones that you rub across the forehead. This is all of like the first aid stuff, your spray bandage and your regular bandages from Welly, ointments and alcohol, just iodine. This is the actual like pain relief stuff. I usually just use a heating pad. Nothing really does it, and I should just use medication that I'm given, but I try not to. I also get injections every month, and every 3 months I get a nerve blocker. This is also moisturizing cream. This has been the one that helps the most. I have a ton of stuff to organize over here. I have masks. I'll show you where the mask area is. I'm gonna try to do this as fast as possible because there is just so much. This is for blood sugar, so if manually I have on my arm the Freestyle Libre, so it should give me my blood sugar all the time, but you can double check. Sugar tablets, I have seizure medication and some mental health medication. I take 2 different seizure medications, well technically 3 because I have an emergency one. My 2-year-old was playing with this drawer, but this is that time of the month drawer. This is extra supplies, cleaning supplies. I get these. And this, I'm not sure what I'm going to put in that drawer yet. I think that I might put like devices and things like that in there. Over here we have our mini fridge, and this holds Protonics and Intuvi, all the things that make the banana bags, and our medication goes in here that needs to be refrigerated. In my fridge are the TPN bags. I use those to literally eat food like the rest of everybody in the world. And these baskets over here, I keep service dog supplies, or their gear, I should say. So all of their gear, and I could get into how I organize all the dog stuff in another video because there is so much that I could share. Besides TPN, this is how much I have to bring for 1 week of travel. So I've pre-packed all of this stuff. This is my normal go bag for everything medical that I need. This is my wheelchair and where I keep all my medical files that I need on hand. This is where we keep all the masks. Below all the stuff I pre-packed, there are drawers full of bandages and headphones because noise is stressful. And then like my back brace, just braces in general. This is like a breathing machine down here, and that's Ruben stuff. I have earplugs if I need it because I have 2 kids and sensory issues. On our bag over here we have the medication I need in case of an emergency. I have paperwork in this bag. So this is actually a camera bag, but it works perfectly for medical. In fact, I even have a little carabiner in here at the top so that I can hang my TPN and put my tubing in, and it can stick out the side down here. And then there's plenty of stuff too. That's my seizure watch, but there's plenty of stuff to keep everything that I need for an entire day of going out. These are the meals that my insurance provides that are the best for my needs, but currently I can't really eat, so I'm using TPN only, which is what I mentioned before right here. Thanks for watching.